Hi, you're watching DNA Today, a multi-award winning genetics podcast where we explore everything to do with genetics, from CRISPR to rare diseases to new research. We have won the Science and Medicine Podcast Award for many years now. We have hundreds of episodes, and we really hope you enjoy these conversations where we dive into so many genetic concepts. I'm Kira Deneen, a certified genetic counselor, and your host.
This episode is the second in a series about the evolving care of urea cycle disorders, or UCDs. In this conversation, we will focus on how clinicians can help patients overcome social determinants of health, or SDOHs, and mental health barriers to UCD care. Don't forget to check out the first episode of this series. That's number 323, supporting ongoing urea cycle disorder UCD care. Our guests for today's episode are Kendra Buracher, an internationally recognized pediatric neuropsychologist who specializes in rare genetic conditions. We also are joined by Erica Vuko, an esteemed metabolic nurse practitioner at Lurie Children's Hospital. Today, we're going to explore how socioeconomic and psychosocial factors impact UCD care, how clinicians can help their patients overcome these barriers, and available resources to support patients with UCD management. Before we get started, we wanted to share that this discussion is sponsored by Amgen. Kendra and Erica, thank you so much for coming on. I'm really excited to dive into this with both of you, with all of your expertise. Erica, to get us started, could you give us a quick refresher on UCDs and share a few things that people may not know about these conditions?
Yes, absolutely. So UCDs result from inherited deficiencies in any one of the 6 enzymes or 2 transporters that are involved in the urea cycle pathway. So to take a quick step back, when our bodies are breaking down protein, ammonia is naturally produced. And usually our bodies are really good at taking that ammonia and converting it to urea, and then it's excreted from the body through urination. However, in UCDs, due to those deficiencies I just spoke to, the ammonia is not able to be effectively converted to urea. And the result is that the ammonia builds up to very high toxic levels. And those with severe deficiency can present in the neonatal period with hyperammonemia. And some of the acute early signs that we see as a result can be poor feeding, vomiting, sleepiness. And those symptoms can progress into lethargy, seizures, coma, and in some instances, death. Now, the late onset UCDs can have a presentation with symptoms that are a little less obvious. So individuals may present with more of a chronic encephalopathy. Patients can present with learning disorders, hyperactivity. You may see an enlarged liver, fragile hair, and in some of our teens and adult patients, we can even see psychiatric symptoms that may present as episodic psychosis or mood alteration. And then in our partial urea cycle enzyme deficiencies, it's really important for people to understand that patients are really at risk for a hyperammonemia crisis really at any time point in their life when they face a trigger like illness or increased stress. And some examples of what those can be, some are a little bit more obvious, like surgery or the peripartum period and the stress of delivering a baby, but also thinking about any instance where there's prolonged fasting or even the case of holidays and thinking about the increased stress that can be associated with those. And then, of course, we're on DNA Today, so we want to include the inheritance of UCDs. And most of these conditions are inherited in an autosomal recessive manner, with the exception of OTC deficiency, which is X-linked. And it's really important for people to understand, and also interesting, that the female phenotype can really range from asymptomatic to significant symptoms where females are experiencing recurrent episodes of hyperammonemia and neurologic compromise.
Yes, you certainly know our audience. I like that plug of just
Yeah.
ending with the genetics aspect of it, because certainly people are interested in and that part. And for any listeners that want to dive a little bit deeper into UCDs, be sure to check out the first episode in this series on DNA Today. That's episode 323, supporting ongoing urea cycle disorder care. And we talk about the pathophysiology and diagnosis in greater detail. And you can also check out episode 282, the evolution of caring for females with OTC deficiency that Erica was just talking about, and learn more about the deficiency in women. So Erica, can you briefly tell us a little bit more about how UCDs are managed and what factors impact management decisions?
Absolutely. So when we think of really any of our inborn errors of metabolism that have acute presentations like we see in UCD, when we think about management, we sort of often divide them into two buckets: our acute management when someone is critically ill, and our chronic management and how we're managing patients in their day-to-day life. But I think what's really important is that the goals of either of those management strategies really are the same. It's just the tools with which we're using that are a little bit different. So when we talk about long-term management in UCDs, it's going to consist of medication that really allows the body to more effectively excrete waste nitrogen. It's going to include a low protein diet, amino acid supplementation, and again, emergency treatment for when those patients are experiencing one of those triggers that I just mentioned. Oftentimes that may look like educating patients and families on what signs and symptoms to be aware of, how to avoid triggers to the best of our ability, how to prepare for them, like an upcoming surgery, and also handing patients and families an emergency protocol so that no matter where a patient were to present, if there were acute concerns, that the team that is seeing that patient would know the steps to take. It's really important that we are individualizing the approach because, as we see in so many genetic conditions, UCDs can really be a spectrum. And so we have to have that more individualized approach in thinking about what is that patient's growth rate, what are their labs showing us in terms of their ammonia level or various amino acids, and using that to guide what we're recommending. And another really important piece when we think about management in these conditions is that it's lifelong. Aside from liver transplant, there really is no commercially available treatment that is a cure for UCDs.
Not yet. And Kendra, to bring you into the conversation, I think it's important to talk about the psychosocial component. So what types of psychosocial challenges might patients and families with UCDs face related to a diagnosis and, as Erica just mentioned, living with a chronic condition?
Yeah, when I was sitting here listening to Erica, I kind of closed my eyes there briefly because I was imagining myself as a parent as she was describing what a UCD was. And really the initial feeling that most parents get when they hear your child has a UCD. You're young as a parent. The initial feeling is being lost and really isolated because you lack that knowledge base. You lack the awareness. You have preconceived ideas of what your child's going to be like. You have no terminology of any medical terms like Erica was discussing, and really limited support networks because you don't know who to reach out to. There's also scarcity of resources, and it takes an emotional toll. But like Erica was saying, it's on a continuum. So even your psychosocial reactions are on a continuum based on your age, what personality type you have, your past medical experience, and really your coping skills. But it's a gut punch. It's confusing. You're in shock, sometimes angry that this is happening to you and your family. And it's a quick turnaround. You don't have much time to process the diagnosis. You feel guilty because what happened? Where did this come from? And then disbelief. A lot of people stay within the denial because it's safe and it's a way to manage anxiety. And when you're in denial, you don't have to progressively move through the steps. You want to stay right where you're at. And of course, uncertainty because things don't make sense or they run counter to what is typical. And then you begin to feel a high level of negative feelings. So fear and anxiety run hand in hand, and the families managing UCDs may experience that wide range on a continuum of psychosocial challenges because it complex, like Erica was explaining. And then so you have the parent guilt and anxiety because they don't have the foundation. They have genetic guilt because, wow, was part of me what passed it on to give my child this lifelong chronic condition? And then you have a period of grief and adjustment or readjustment time. And then just thinking about that within the first couple of weeks, you can even experience burnout. So chronic stress and burnout. And then the family dynamics typically change. There's financial, logistical stress that comes with it, but I'll get into that more in a little bit.
Yeah, let's talk about that because the social determinants of health, or SDOH, that's an important aspect to this and a realistic one that I think we should address.
Absolutely. I have a high interest in social determinants of health. And for those who don't know what that is, we often use the acronym just SDOH. And it is any non-medical factor that can impact your health or longevity. In many talks, I give the analogy of the tip of the iceberg. And when parents and patients or caregivers and patients go into their healthcare provider, what you are showing your healthcare provider is just that 1/8 of the tip of the iceberg. Because you come in your Sunday best. You come dressed up. You come pulled together because you don't want them to make any assumptions about you. You're pulled together. But everything else is the 7/8 that is under the water. It is the weight of that invisible battle. The U.S. Department of Health and Human Services has broken down social determinants of health into 5 groups. I'll just briefly go through some of these and give you some examples. One of the social determinants of health is economic stability. So factors related into really how much money do you earn and how well does your income meet your family's health and other needs. So do you have a steady income, stable job? Because poverty out of all of the SDOHs can impact almost every part of your life. So do you have enough money to pay for housing? How about your utilities? So it's non-medical aspects. Does your employer offer health insurance? Do you have sick leave at your job? And then the second one is education, access, and quality. So factors related to the education you receive and how well it supports your individual learning needs. So poorly performing at school and bullying will affect your health. We all know that bullying and being in certain schools will affect your health. So does your family have funds to send your child to college? Does your child's school district support them having a urea cycle disorder? Health care access and quality are the factors related to the medical care you receive and how well it can meet all physical and mental health needs. So insurance, online records, do you have access to telehealth? Language barriers and no insurance impact the health access and quality. So let's think of some of those questions. Do you have a primary care provider? Many patients that I saw didn't even have an establishment with a primary health care. Do you feel comfortable talking to your provider, or can you access and understand what they are saying? The simple terminology. And I know in my instance, when I talk about psychological terms, I sometimes have to catch myself because I use acronyms that maybe my patients or caregivers do not understand. Can you get your medical records? Some people cannot even access their medical portals because of their internet service. Neighborhood and built environment. So factors related to your zip code or the specific community you live in. Childcare. Are you safe? Do you have nutritious foods? Can you access them? Do you live in a community that has polluted water? All of these affect your health. And just a story about my own child that needed help. He lived in a zip code that was considered underfunded. And every time he had medications sent to his apartment, it was stolen because people around him in the same apartment knew that he was in need of some medications. Also, just going into his neighborhood, I was stopped often by police officers saying, "Why are you here?" And I'd say, my son needs help. And they'd escort me into the neighborhood. Many cannot relate to that because zip codes range differently and certain neighborhoods are funded. So it's all those little things, the social and community context. So do you have family and friends who make you feel supported and uplifted? These are factors related to your relationship with family, friends, and coworkers and community. A lot of times with my patient, and the parents, when they got a diagnosis, it was really awkward to tell their friends what it is because they felt isolated because nobody understood. And in reality, sometimes the friends would not touch base with them because they felt awkward. They didn't know how to receive the information that their best friend's child was born with a metabolic condition. And so they become isolated. And even the ring, that closest ring of family members, and they, like grandmas and grandfathers, oftentimes don't understand what a UCD is. And they go, maybe we could just give them a little of this or a little of that. So that causes a lot of stress as well. So in summary, these are the non-medical aspects that can affect your health and longevity.
And I'm sure a lot of people have heard before that your zip code, for people that are in the United States, that would be the certain area you live in. Either your city has a zip code or little section of a city has a zip code. So it's a very specific area, and that very much impacts someone's health. You talked a little bit, Kendra, about how this can impact patients with UCD. Erica, do you have anything to add to that in terms of why it's important to identify and address these SDOH barriers in specifically the UCD patient population?
Absolutely. I think a huge aspect to this is thinking about sort of the natural history of these disorders and thinking back to what I had reviewed earlier and how the episodes of hyperammonemia can affect patients, especially in terms of their neurologic health. And so we know that those hyperammonemic episodes can be cumulative in terms of impact and outcome. And so a patient's UCD clinical course can absolutely play a role in the health outcomes that we see in these patients. But in the same way, so do those complex social determinants of health factors that Kendra was just reviewing as well. And so I think a great example of that comes in considering health literacy or cultural barriers. And so thinking of how health literacy can play a role in a family's ability to understand what the diagnosis is. As we've been discussing, these are complex disorders with complex mechanisms, with multifactorial management approaches. And so that is a lot for any family unit to take on. And when you are dealing with someone who may not have the health literacy to be able to really understand what you're explaining to them, and if you don't take that into consideration, there can be gaps in understanding what exactly the signs and symptoms mean when a patient becomes more sleepy or when they have poor feeding, and maybe the importance around why we're doing what we're doing with those various management approaches. Also, we want to think about access. Access is a huge, important piece for the success of our patients in many different aspects. Thinking about access to emergency treatment, how close is a patient or family to a medical center that can adequately manage these rare conditions, but also access to food, and not just regular food, which is obviously important for overall well-being and nutrition, but also thinking about the fact that low protein foods are a huge piece of that management toolbox. And so thinking about where I'm at locally in the state of Illinois, where patients can go and find low protein medical foods. And there's one shop in the whole Chicagoland area where someone can physically go and purchase these items. And do patients have cars? Do they have access to pay for gas for driving the potentially long distance required to get to that store? And if not, that limits patients and families to ordering online these special medical foods and dealing with the extra shipping costs. So all of that plays such an important role in patient and family's ability to carry out the management plan that we're prescribing. And that is important because, as I mentioned, that all plays into a patient's health outcomes. So economic disparity, health inequality, those challenges impose barriers to how our patients are getting diagnosed, how they are able to access emergency services, and how successful they are able to be in terms of their treatment.
Which makes it so important for clinicians to take this information in so they can better treat and help support their patients. Are there ways that clinicians can screen and assess their patients for SDOH barriers of care? Because we've listed a bunch. You both have listed so many at this point. I mean, what types of tool processes have worked well, maybe in your own clinical practices, of how you've been able to integrate this into what you're doing? Kendra, do you have thoughts on how you've been able to do this over the years?
Really built into some of the common electronic medical record apps or the hospital electronic health records. They often had templates with a few basic questions. So like Epic would have social determinants of health wheel, and they would integrate the tools like Prepare, Prapar. So it's the protocol for responding to and assessing a patient's assets, risks, and experiences. But even just personally for urea cycle disorder, when the patients came in, I would just ask about the impact of, are they able to access foods? Like Erica said, even if they had to order them online, do they have the basic skills of how to go in? Where do I order it? What's the website? How do I do this? How much do I order? And then it has to be delivered to the house. So is my house secure enough to receive some of those medications or low protein foods? And then I would ask, they do have limited access a lot of times in transportation. And if they came a long, long distance, and often they did, and then financial strain. I remember a mother being extremely hungry. They had to get up very early. She came in. She was, I could tell by her body language, she was very stressed out. And I just said, can we take a minute? May I go get you some water? So there's ways to do it. Even if you don't have, you can actually make up your own form that just simply, or have it in your head. But a lot of the electronic health records have it. I don't know if Erica, if you use something similar.
Yes, we definitely tap into the tools within the EMR, electronic medical record, to be able to push out these questions. We can do it through the MyChart platform, where patients actually get the message with the survey questions ahead of their clinic visit, which is helpful to be able to anticipate needs or prepare resources to be able to review during their clinic visit. And I know in talking with clinicians across the country, staffing time, sometimes these are perceived as pretty major barriers to ask these questions. But I think what we're highlighting here is asking these questions is critical to the health outcomes of our patients. And so we need to find ways and getting creative into how we make sure that we're assessing for this. So whether you're pushing it through your electronic medical record, whether you're printing these and having the medical assistant or the nurse, who's ever rooming the patient, perhaps providing them with that form while they're waiting for their provider or clinical team to come into the room, that can be another way to sort of get around the staffing and timing. but really important to ask and think about how are ways in which we can tap into systems already built within our organization to ensure that we're asking patients these questions.
Anything else when it comes to the more system approach and outside of your own time with patients, having your teams support them and looking at that higher level?
One thing that we do, which I recognize that obviously clinic to clinic across the country is going to be resourced differently, but we are very lucky at our institution to have 2 social workers embedded within our division. Thinking of like an organizational level is assessing if you don't have a social worker embedded within your clinic, likely you do have social workers within the organization. And so thinking about the social workers that are typically assigned to a particular unit in the ICUs, for example, or the case managers, that sometimes the inpatient setting has some resources embedded within it. And so working with those groups to be able to pool resources, to be able to use opportunities if a patient is admitted, especially at that initial diagnosis. With a lot of these severe UCDs, they're going to present typically very early in life with a hyperammonemic crisis, and usually that's a prolonged hospitalization. And so utilizing that opportunity when you have the patient and family within the organization to be able to do some of these assessments. It doesn't always have to rely on the ambulatory or outpatient workflow.
Anything to add on to that, Kendra, in terms of your approaches and your team?
Typically, the screening tool or survey or questionnaire would go out ahead of time so that they could fill it out. But if they didn't bring it in, we did have social workers that were embedded into our clinic as well. And if time was a constraint, then I would often ask them the questions. So it was just basically part of our routine evaluation that we evaluated that, because we knew that any time that I would make a recommendation to them or see them or answer anything, that the social determinants of health would impact anything that I did as a neuropsychologist. So it was pretty much embedded into our clinic time.
You've both brought up social workers and that aspect of supporting parents going through this and the people that are taking care of others with UCDs. I think it's great if we could expand on some of the feelings patients and families may face related to a UCD diagnosis. Some of that might be guilt and fear that we touched on earlier in the episode. Can either of you expand upon the specific ways in which the need for ongoing UCD management may impact the mental health of, again, the patients and the families?
Well, social determinants of health actually start at birth and they're changing. They change over time. So I want to kind of step back on the previous question. We have to continue to check the factors that are affecting families through their everyday life, because it will change. Sometimes people move or they get better jobs. So I just wanted to stress that as well. But the more you feel comfortable with sharing, the more your provider can help you. I just wanted to say that, and to make the experience feel safe and non-judgmental. I just want to talk about compassion for a little bit. There's a book called Compassionomics, and it's by Stephen Sarek. I'm sorry if I mispronounced that name, and Anthony Mazzarelli. And it is scientifically based. It's evidence-based approach where healthcare providers recognize, understand, and take action to alleviate any of the patient's suffering. And people often ask me, well, it takes a lot of time to be compassionate, but they've done study after study where it takes only 40 seconds. So to break down some of those barriers, I would suggest being compassionate. The words that healthcare providers use is very crucial because they can shape a patient's understanding and emotional response. Words also play a key role in their person-centered, where clear, empathic, and respectful communication can come in. Well, there are ongoing management that I would like to suggest, but The barriers that they feel is the chronic stress. And at times it's really anguish. I would like to call it anguish. I've seen a lot of patients and their caregivers come in because they're living with an ongoing metabolic episode may occur at any time. So they're always kind of on edge waiting for the next shoe to drop. And then they have to be constantly vigilant. Families must continuously monitor their diet, their symptoms, medications, lab results, and then the unpredictability. There's also a term that's called decision fatigue, where the daily choices, and I've had many parents say this to me, I'm so exhausted about making decisions that I become so fatigued that if somebody asked me to make a decision about what kind of pizza I wanted, I wouldn't know what to do. I wouldn't even know how to say that. But also this decision making has impacted by the constant need to balance that quality of life that they have and managing the health risks. And then the strict dietary limitations are very important that we have to think about as well. It becomes exhausting and it might lead to perpetual medical trauma. And that's where the person actually feels that their trauma is caused by their own health. And so it's perpetual trauma and then the isolation that comes with it. So I think children and adults with UCDs may struggle with some of the social inclusion due to the dietary restriction. And then, like, we're going to get into the depression and emotional exhaustion.
Yeah. Anything to add on to that, Erica, just in terms of, that mental health perspective?
Kendra really hit on a really important point and something that I know I've heard directly from parents as well, is that fatigue and just in a moment of vulnerability, sharing that they just want one day where they don't have to think about this condition, and really eliciting that compassion from us as a care team, recognizing how much this diagnosis drives the day-to-day of not just a patient, but that entire family unit, and making sure that we're cognizant of that. I think also when we think about the mental health component, really understanding just the stress that comes to play when someone's navigating a chronic illness. And not only that stress of chronic management for their lifelong condition, but also thinking about the impact the clinical course itself can have on a patient. So yes, we have the day-to-day component that can play a role in patients feeling depressed or struggling with their identity, with confidence, because they have to have a special diet. They have to drink a formula. They're navigating questions and they're feeling like this makes them different from their peers during a time point when so many adolescents just want to blend in. They don't want to highlight anything that makes them different from their peers. And so how that can play into a patient's mental health, but then thinking about a hyperammonemic episode and being in a hospital for an extended period of time, missing school, missing any activities that they may be participating in, and what that also does to a patient in terms of their mental health and their well-being. So there's a lot of different aspects when we think about mental health and what can play into it outside of the elevated ammonia and how that affects the brain. But then we have all these other factors that can affect a patient's well-being as well.
Yeah, and living in that constant stress, like you said, of managing just the dietary restrictions or taking medications or feeling different, the self-esteem, and they become frustrated. I don't know if you mentioned that or not, but just how frustrated it must feel in the sense of helplessness or resentment towards their condition, which oftentimes leads to them becoming withdrawn and breaking from some of their social interactions with their friends because they don't want to deal with it anymore.
And that makes sense, especially when we're looking at food. Food is so much a part of being social, right?
Yes.
I just got a text from friends saying, hey, do you want to get together for dinner? And they already chose the restaurant being a part of society, and so many aspects revolve around food. And that makes it very challenging for anyone that has a metabolic condition. How can the multidisciplinary metabolic team support patients and families with UCDs who are going through these mental health challenges and trying to navigate living a life with a metabolic condition, especially UCDs, obviously?
It's the overall small sustainable changes rather than getting them to do an overwhelming lifestyle overhaul. I think that the small goals that both you and the patient come into agreement with are very important, and then validate the emotional toll of UCD. Emphasize the progress they're making over perfection. So that gets away from shaming them, and use plain language education. Everyone's on a continuum. Some people understand it right away and they're very good at looking things up where others are not. So I think it's a combination of education, outreach, improved access to mental health services, reducing the stigma, using words and word choice carefully, having compassion and being supportive, and then integrate that mental health into routine care. Erica had already touched upon this. Discuss mental health openly during clinic visits so it doesn't come upon them like a surprise. Make a psychologist part of their team or a neuropsychologist part of their team. And just provide information on the psychological effects like anxiety and depression. Because I had a person in an audience raise her hand one time after I was describing what depression was. And she said, I've been depressed. I didn't even know it because I'd never heard anybody describe it before. So she lived with this for a very long time. And then encourage families really to seek counseling or support groups or how to navigate things like this. And then maybe some of the support groups or online communities as well. So really embed the mental health discussions into your routine care.
And what resources do you both recommend in terms of what could possibly help patients and they navigate so much of what we talked about today of SDOHs, mental health barriers to UCD management? You've shared so much great advice and insight on this. Is there anything else that we can point people to that have these disorders?
I think it's always great to look to patient organizations. So oftentimes the patient organizations will have resources that we can refer our patients to or do some research or partnership with them as well. National resources, the National Organization of Rare Disease, or NORD, is a phenomenal resource that I know we tap into. And so making sure that we are aware of what those resources are and not only telling patients about that, but I think Kendra brought up a good point earlier when we talked about ordering low protein food and making sure someone understands how to actually do that process. And I think it's the same with a lot of these resources. We have the Department of Specialized Care for Children in the state of Illinois, which is another great resource that can help with low protein food coverage and transportation needs. But a lot of these programs come with paperwork and an application process that can feel really overwhelming for patients and families that are already navigating so much. So just being aware of that as a clinical team, that it's not just talking about these resources, but really making sure we're walking patients and families through that process to be able to actually utilize those resources.
Yeah, NORD is such a great resource. Got to give them a shout out. We interviewed the CEO and president on episode 332. And I started as an intern there 10 years ago, and I've kind of just been promoting them since because they are such an amazing resource for any kind of rare diseases globally. Kendra, what did you have to share?
I totally agree. There are national and local associations that would help as well. And I always go to them. But like Erica said, you have to ask them, do they understand the process? I know that in psychological terms, if we hit a website and we have to do more than 2 or 3 clicks, we just get out of it. So we have to make sure that they understand where to go within NORD to get some of the resources, or the National Urea Cycle Disorder Foundation, or Global Genes, or GMDI. We have to just not hand them a pamphlet, but also recognize maybe make light of it and say, some of these are really hard to navigate, but if you need help, I'm here for you. If you need help, I can kind of walk you through it for 5 minutes while I'm sitting at the computer. I think just saying what Erica said, that sometimes it's really difficult to navigate or understand the paperwork. So
I also just want to quickly make a plug for peer support. We didn't really touch on that too much. And I think that can be invaluable for not only a family, but also for patients to be able to connect with someone that really is able to empathize because they are walking that same journey. And so obviously you can get support in terms of mental health, and there can be psychosocial benefits from those relationships, but also for exactly what we're talking about. A family may have gone through or had to navigate a similar barrier and can offer creative solutions to another parent or family who may be experiencing the same thing. So making sure that as a clinic, we are offering the ability to connect patients and families with other patients and families, but that we're also encouraging them to connect if they're open and ready for it with maybe support groups that are local or national.
Yeah, those are so important, especially the parent usually run organizations for that specific disorder because they have so many resources, and connecting with the founder or other people that are parents very involved in the organization, they're going to have so much more insight, and being able to provide, oh, this is what I did. Let me help you walk through that, just like your providers might be able to as well. But Kendra and Erica, thank you so much for coming on and sharing so much important information and your insight of being providers and for people with UCDs. This has just been such a valuable conversation. As we wrap up, is there anything else that you'd like to share?
Well, I think today that we've explored how UCDs, or a rare metabolic disorder, really does intersect with real world challenges of social determinants of health and access to care, food security, financial burden, and health literacy cannot just be barriers. They can make or break factors in a patient's outcome, like we've discussed. And as a clinician, understanding these layers is really crucial to improving care. Just listen beyond the diagnosis, ask about food and transportation and stressors, and know your resources. Connect with families with genetic counselors, dietitian, and high five to Erica, the patient support organizations.
I think I would echo a lot of that. We have to manage and support the whole patient, not just the disease. We have to ask the questions and ask them in a thoughtful way. If we are focused on just the clinical components, then as a care team, we've missed the mark. Hammering on about the importance of drinking formula or taking a medication consistently when someone is worried about where they're going to live, how they're going to be able to afford food, that's a missed opportunity. And it's not to say that management follow through isn't important, because of course it is, but it's not going to land or have a meaningful impact if we haven't done our jobs to fully understand where our patients and families are at when it relates to the basic needs in life.
Well said. Wonderful final thoughts. Thank you both so much for coming on.
Thank you.
Thank you for having us.
Thanks for watching DNA Today. To access all of our episodes, head over to dnatoday.com. We also have a lot of bonus content on there that you can enjoy. If you have any questions, comments, suggestions, guest pitches, you name it, send them in to info@dnatoday.com. We'd also really appreciate if you could take a moment to rate and review the podcast on Apple, Spotify, wherever you listen to the show. It really helps more nerds like yourself find the show. Also, if you like giveaways and other ways to connect with us, I recommend following us on social. We're at DNA Today Podcast. We also have a Patreon if you want to be the most level involved in the show. That's also at DNA Today Podcast. Thank you so much for listening and watching. Join us next time to learn and discover new advances in the world of genetics.